Hello and welcome to today's edition of Gross Anatomy. Alright, so today we're gonna cover the blood supply to the lower extremity. Blood supply to the lower extremity. Alright, so most of the time the blood supply comes off from the abdominal aorta, and then we have the common iliac artery. So the common iliac artery gives off two branches. We have the internal and the external. Alright. So the common iliac artery, we have the internal iliac artery right here, and we have the external iliac artery. For now, we're gonna focus on the external because these are the branches of the internal iliac artery. We will talk about this one later. But for now, we focus on the external iliac. So these are all branches of the external iliac artery, okay? All right, so the external iliac artery has so many branches, but we are interested in the two terminal branches, all right? The two terminal branches, we have the inferior epigastric artery and the deep circumflex iliac artery. These are the two terminal branches because it usually shows up on exams. Like on exams, they can ask you, what are the two terminal branches of the external iliac? And then you remember them, all right? Inferior epigastric, deep circumflex iliac artery. So when the external iliac artery crosses the inguinal ligament, it becomes the femoral artery. Where is the inguinal ligament again? So the inguinal ligament, it originates from the anterior superior iliac spine to the pubic tubercle, all right? Right there. And then when the external iliac crosses, it becomes a femoral artery. So what does this mean? This means we are in the thigh region, all right? So this means the femoral artery will provide blood supply to the anterior muscles of the thigh, all right? And then from the femoral artery, we have the profunda femoris. So the profunda means deep, all right? So this is the deepest branch of the femoral artery, the profunda femoris. So in the thigh, we have the adductor canal, which is also known as the subsartorial canal, which is like a space which is found below the sartorius. Sartorius is one of the muscles which are found in the anterior thigh region. Now, when we go through the muscles of the anterior thigh region, we're going to talk about the sartorius, so it makes sense. All right, we'll talk about the adductor canal. All right, so when the femoral artery crosses the adductor canal, it becomes the popliteal artery. All right, so the popliteal artery is in the knee region. All right, so the popliteal artery is supplying the knee, and then it gives off branches called genicular arteries. All right, so in the popliteal artery, we have superior genicular arteries, we have inferior. All right, so we have four. We have superior medial, inferior medial, superior lateral, inferior lateral. These are genicular arteries which give blood supply to the knee joint. So on the exam, they can ask you, a patient presents into your clinic, complaining of pains in the knee joint and stuff like that. Every time like there is lack of blood supply, you look at the area where there is lack of blood supply, and once you know which artery is running in that region, then you come up with the answer. All right. And most of the time too, like on the exams, they will ask you questions like, for example, when we talk about the anterior thigh, there are so many muscles, like the sartorius, like I was talking about, right? Or maybe the quadriceps, femoris muscles. So let's say someone comes in and then there is, a little problem with the vastus medialis or vastus lateralis, and you know that if there is any form of fracture or the patient complains, in that region, then the blood supply in that region is provided by the femoral artery, right? So you think of it in that way. And then from the popliteal artery, it becomes the tibial artery, all right? The tibial artery will give off two branches. We have the anterior tibial and the posterior tibial, all right? And then the posterior tibial, we talked about the anterior, but the posterior tibial will give off two branches. It will give off the fibular artery and the plantar artery. All right, so the posterior tibial, two branches, the fibula or the fibular artery comes off from the posterior tibial artery, and then we have the plantar artery, and then the plantar artery we give off two terminal branches, which is the medial plantar and the lateral plantar, which is right here. So on the exam, they can ask you, what is the terminal branch of the tibial artery? What is the terminal branch of the posterior tibial artery? And the answer, medial and lateral plantar. So the medial and lateral plantar, they will supply areas in the foot. I don't want to talk about like where they are being supplied and stuff like that, because like there are other lectures which talks into detail about this artery. But for now, I just want you to know where each artery is branching from, where each one is going and stuff like that. All right. And then when we come to the anterior tibial artery, all right, so for the anterior tibial artery in the leg region, so the leg, the anterior surface of the leg, all the muscles there will be supplied by the anterior tibial artery. So the anterior tibial artery, when it goes into the foot, it becomes the dorsalis pedis. All right. The dorsalis pedis, you can feel the pulse of the dorsalis pedis in the, I think it's lateral to the extensor digitorum longus. It usually shows up on the exams like is the dorsalis pedis. They ask whether it is medial or lateral, and then it's usually lateral to the extensor digitorum longus in the foot. All right. So the dorsalis pedis in the foot, it becomes the arcuate artery, and then the arcuate artery gives branch to the dorsal metatarsal artery, which will give blood supply to the metatarsals. And then it becomes the dorsal digital artery, which will give all this to the proper digits of the foot. All right. So this is all about the blood supply coming from the external iliac artery. All right. Does it make sense? I just go over, draw everything out, know which one is coming from where, and it makes sense. All right. So let's go to the internal iliac. When I started, I said that blood supply comes from the abdominal aorta, and then we have the common iliac. The common iliac gives off the internal iliac and the external iliac. So for the external iliac, this is all the branches we spoke about. Now we are off to the internal iliac. So for the internal iliac, first of all, it gives off two branches, anterior and posterior. Posterior is easy. Why? Because it only has 3 branches. It gives off only 3 arteries. And we have different mnemonics, I, L, S. People, you can come up with a mnemonic. All right. So there are 3 branches of the posterior branch of the internal iliac. I, L, S. I like sex. I like socks. I like whatever mnemonic you want to use to remember will help. All right. So the first I, iliolumbar artery, which is the first branch. All right. So when you are dissecting in the lab, all right, and then you go to the posterior, you see 3 coming off. And then we have the lateral sacral. So this is the iliolumbar, lateral sacral. And then we have the superior gluteal. All right. The superior gluteal, we usually find it in between the S1 and the lumbosacral trunk. It's usually kind of hard to find. So on the when you go to the lab, look for anywhere in between the S1 and the lumbosacral trunk. All right. So what are the posterior branches? What are the arteries which comes off from the posterior branch of the internal iliac? ILS, I, iliolumbar, L, lateral sacral, S, superior gluteal. All right. Now for the anterior. So for the anterior branch of the internal iliac, we have so many arteries. We have so many branches. So the first one we'll talk about is the umbilical artery. And umbilical artery will give off branches like superior vesical artery. All right. We have the arterial artery, which also comes off from the anterior branch of the internal iliac. Well, sometimes there is an accessory arterial artery which comes off from the inferior epigastric. Okay, let's review here. Where does the inferior epigastric artery come from? It is the terminal branch of the external iliac. It is one of them. The second one is there. All right, it's right here. All right. So there could be, I think, in 20% of cases, it's not something that is common, but in 20% of cases, all right. So there is an accessory branch of the obturator artery which comes off from the inferior epigastric, which will anastomose with the obturator artery, which comes from the anterior branch of the internal artery, and we call that anastomosis the corona mortis. All right. During surgery, it's very, very easy to cut this off, and then it leads to a lot of blood coming out and stuff like that. So it's one thing that surgeons needs to make sure every time they want to do surgery, they have to make sure that there is no accessory obturator, artery coming off from the inferior epigastric. All right. So let's look at the other branches. We have inferior vesicle. Inferior vesicle for males. For females is the vaginal artery, which gives off to the vagina. We have the uterine artery, which gives off blood supply to the uterus. And then we have the middle rectal. All right. So the terminal branch of the anterior branch of the internal iliac. This is funny. You have to be able to draw this out and keep drawing for it to make sense, for you to really understand, because there are so many branches right here. And it is called the internal pudendal. So internal pudendal, that's the terminal branch of the anterior branch of the internal iliac artery. And then the internal pudendal will give off branches like the perineal branches and the inferior rectal arteries. All right. So what are the two branches of the internal pudendal artery? Inferior rectal, perineal artery. All right. And then we have the inferior gluteal artery. All right. For the inferior gluteal, it is very, very hard to find in the cadaver. So always make sure you look between S1 and S2. Between S1 and S2, you're able to find the inferior gluteal. Just like for the superior gluteal, you find it between the lumbosacral trunk and S1. All right. So yeah, this is blood supply to the lower extremity. So every time you are studying, all right, when you are, most of the time the professors, they go into details, all right. So just use this as a blueprint to navigate your way, because sometimes you get lost in the bulk of the lectures, and then you start getting confused. So just make sure you draw this out, and then begin to track where each and every artery is going and stuff like that. All right. Good luck on your exam. Good luck on any exam which is upcoming. All right. If you like this, subscribe, because I'm gonna be posting more videos. Thank you for watching, and God bless you. Bye bye.